37 million people in the U.S. will be diagnosed with chronic kidney disease, and as many as 9 in 10 people are not aware they have it. And you have diabetes or high blood pressure, you are at risk of developing kidney disease. And March is National Kidney Month, with this year's campaign focusing on efforts to increase education and awareness. Joining me now is Dr. Vishal Jaikaransingh, an assistant professor in the Division of Nephrology at UF Health. Good morning. Thank you so much for joining us.
Good morning. Thanks for having me.
First and foremost, can you explain what our kidneys do and the role that they play in our overall health?
Yes, for sure. So your kidneys are extremely important. They work together with all the organs in your body to keep you functioning well. A lot of it has to do with control of things like fluid status, control of things like electrolytes, and then there's some unexpected things like maintenance of bone health and even helping your body make blood. So the functions of your kidneys are widespread and they're very important for maintaining good health.
And we hear a lot about kidney stones and kidney failure. What other conditions should we be aware of?
So when we put all of this under the umbrella of chronic kidney disease, there are multiple disorders that would contribute to that. Certainly things like developing diabetes or hypertension, kidney stones can definitely contribute, but there are inherited disorders. Sometimes some disorders run in families and they're much more common. And as we're getting awareness of chronic kidney disease that's increasing, it may be well worth talking to family members, talking to loved ones. And whereas people would have been unaware previously, with much more screening going on, you can catch these things much earlier.
And how do you know if you have chronic kidney disease?
So that's a big challenge. Like you said, 9 out of 10 people with kidney disease have no idea that they have it. So certainly there are symptoms like decreased or increased urination, fatigue, blood in the urine, foamy urine, muscle cramps, swollen feet or ankles, changes in appetite. But sometimes these symptoms can be quite late in the presentation, which is why the vast majority of people with kidney disease don't know they have it. I think even more startling statistic is that about 1 in 2 patients with very advanced kidney disease, extremely low kidney function, where they're very close to needing advanced therapies like dialysis, would have no idea that they have kidney disease. So in addition to looking out for symptoms, it's really important that risk factors are identified early and screening be done early. And this can be done best in conjunction with your doctor.
And what are the best ways to make sure that your kidneys are healthy?
So some of it is pretty intuitive, actually. When we talk about maintaining good health overall, you're talking about maintaining a healthy diet, exercise, limiting things like your salt intake, staying well hydrated, especially in Florida during the hot summers, looking at medication. So really working with your doctor, understanding potential side effects or medicines that may not go well together, and early detection. And that's kind of where our focus should be, where we're talking about keeping people's kidneys healthy. We want to know really early in the course if someone has chronic kidney disease.
All right. Well, this is all wonderful information. Thank you so much for joining us this morning.
Well, thank you very much.